Our today's topic is mammary gland, which is in layman terms called the breast. Breast is basically a glandular and supportive fibrous tissue which is embedded within a fatty matrix. Grossly, what we need to know is that what is the extent of breast. So vertically, if we see the breast lies from the rib to second rib till the sixth rib. So second to sixth rib is the vertical extent of breast, and the horizontal extent is from the lateral border of sternum till the mid-axillary line. Mid-axillary line is basically an imaginary line that is drawn from the middle of axilla here. So the vertical extent is from the second rib to the sixth rib, and the horizontal extent is from the lateral border of sternum to the mid-axillary line. From breast is divided into four quadrants. The upper outer quadrant of the breast gives a tail, which is called the axillary process of breast or the axillary tail of Spence. Here it is surrounded by the pectoral fascia, and in this area the axillary tail of Spence pierces the pectoral fascia to enter axilla. The the foramen through which it passes through is called the foramen of Langer. Here this is foramen of Langer. As I've mentioned earlier, that the quadrants of the breast are the upper outer quadrant, the upper inner quadrant, the lower outer quadrant, and the lower inner quadrant. We can also call it like the upper lateral, lower lateral, upper medial, and lower medial. So the upper outer or upper lateral gives off the tail of Spence. The deep relations of the breast or the structures lying beneath the breast or the structures making the bed of the breast are the pectoral fascia, which is covering the pectoralis major muscle, and the serratus anterior muscle along with its fascia below it. As I've mentioned earlier, that the breast is a content of superficial fascia. So all the muscles of the pectoral region are lying beneath the breast because it is in the superficial fascia. So the structures making bed of breast are the pectoral fascia, pectoralis major muscle, serratus anterior muscle, and its fascia. Now, what is retromammary space? As we can see in this picture, the area that is between the breast and the pectoral fascia, there is a space which is called the retromammary space. And what is the function of the space? This space allows the breast to move freely against the chest wall. Now we'll come to the structure of the breast. The structure of breast has three things. We'll discuss it in three domains. One is skin, one is parenchyma, and one is stroma. So first of all, we'll discuss skin. Skin has nipples and areola. In this picture, we can see this is the nipple, the projection, and the areola, the pigmented area surrounding the nipple. So the level of nipple is at the level of fourth intercostal space, 10 centimeters from the midline. This location of nipple is important. So nipple lies in the fourth intercostal space, 10 centimeters from the midline, and 15 to 20 lactiferous ducts open it. In this picture, we can see these are the milk ducts or the lactiferous ducts. They eventually open here on the nipple. Now, a few points about the areola. Areola is the pigmented area circular which is surrounding the nipple. So in areola, there are lactiferous sinuses. Sinuses are small dilatations of lactiferous duct, and later on it opens into the nipple. The areola has sebaceous glands which become enlarged during pregnancy, and they are called the tubercles of Montgomery. As I've told you earlier that we will discuss breast in under three headings. First was skin that we have discussed. Now we'll discuss the parenchyma. Parenchyma is the main structure of the breast. Generally breast is a compound tubulo-alveolar gland. We'll discuss parenchyma in this picture. These are small grape-like clusters called the alveoli. The alveoli are the alveoli clusters of alveoli, they form the lobules of the breast. Multiple lobules combine and they form the lobes of the breast. This is one lobe of the breast. In one lobe of the breast, there are multiple lobules. The lobules open into ducts, which are called the lactiferous ducts. The ducts, before opening on the nipple, show small dilatation, that is called the lactiferous sinus. Here, this is lactiferous sinus, and then it eventually opens here on the nipple. In side view, we can see that these clusters of alveoli form the lactiferous lobules, which multiple lobules form a lactiferous lobe. The lactiferous lobes, they open into ducts. They are drained by the lactiferous ducts. The ducts show a small dilatation called the lactiferous sinus, and then it opens on the nipple. In this picture, I'll repeat again. These are the alveoli. The alveoli combine and form a lactiferous lobule. The multiple lobules form a lobe. The lobes are drained by lactiferous duct. The duct shows a small dilatation at its end, which is called lactiferous sinus, and the sinus eventually opens on the nipple. Now, the third heading was stroma. Stroma is the supporting framework of the breast. In this picture, we can see this greenish structure is the parenchyma that we have discussed earlier, constituting of the lobules, lobes, ducts, and the lactiferous sinus. The supporting structure or stroma is these suspensory ligaments. These red structures are the suspensory ligaments of Cooper. Now we'll discuss briefly the vasculature of the breast, or the arteries and veins supplying the breast. So basically, breast is supplied by branches of three main arteries: the subclavian artery, the axillary artery, and the thoracic aorta. The medial mammary branches of internal thoracic artery, thoracoacromial, lateral thoracic, and superior thoracic artery of the axillary artery, and the lateral branches of posterior intercostal arteries of thoracic aorta, they are supplying the breast. In this picture, we can see that these are the medial mammary branches of internal thoracic artery. This is the axillary artery giving off thoracoacromial, superior thoracic, and lateral thoracic artery. And these are the lateral mammary branches of posterior intercostal arteries. These three arteries and their branches are supplying the breast. In this picture, we can again see this is axillary artery coming from the subclavian. It gives off superior thoracic, acromiothoracic, and lateral thoracic artery. Then these are the medial mammary branches of internal thoracic artery, and these are the lateral mammary branches of the posterior intercostal arteries. These three arteries are supplying the breast. Now, veins follow arteries. Remember this always. The veins follow arteries. The veins of the breast are divided into superficial veins and deep veins. The superficial veins, they drain into the internal thoracic vein, and the deep veins drain into the axillary vein and posterior intercostal vein. Now look at this picture. This is the axillary vein. This is the posterior intercostal vein, and these are the internal thoracic veins. So all the veins are drained into the internal thoracic, posterior intercostal, and the axillary veins, and these veins are according to the arteries. So veins are following the arteries. It is as simple. Lymphatic drainage of breast is the most important topic. If you ask me what is one thing that you have to study in breast, just go through the lymphatic drainage. Lymphatic drainage of breast is via a certain group of lymph nodes and lymphatics. The most important lymph nodes are the axillary lymph nodes and the internal mammary lymph nodes. In this picture, we can see all the lymph nodes that were enumerated on the previous slide. These are the internal mammary or parasternal lymph nodes. These are the axillary lymph nodes, the various groups of axillary lymph nodes. Axillary lymph nodes are lying in the region of axilla. It is further subdivided into various groups. So, in a nutshell, the lymphatic drainage of breast is divided into various lymph nodes and lymphatics. The lymph nodes are axillary lymph nodes, the parasternal lymph nodes, and few other lymph nodes. The axillary lymph nodes are further subdivided into anterior group, posterior group, central group, apical group, and lateral group. Now coming to the lymphatics are divided into superficial lymphatics and deep lymphatics. The superficial lymphatics, the skin except the nipple and areola is drained by the superficial lymphatics, and the parenchyma of the breast along with nipple and areola is drained by the deep lymphatics. Most of the lymph from the lateral breast quadrants goes into the axillary lymph nodes. So up to 75% of lymph drainage of the breast is via axillary lymph nodes. That's why they are very important. Now the medial breast quadrants are drained by the parasternal lymph nodes, and from here the lymph can also go to the opposite breast. The lymph from inferior quadrants may pass to the abdominal lymph nodes, which include the subdiaphragmatic lymph nodes. So here we can see this is the breast, these are the medial quadrants, and these are the lateral quadrants, and this is the inferior quadrant. So the medial quadrants are drained by parasternal lymph nodes, and lymph from here can go to the other breast. So if there is a carcinoma of breast of this side, it can spread to the other side through the parasternal group of lymph nodes. The lateral group quadrants are drained by the axillary lymph nodes here, and the inferior quadrants are drained by the subdiaphragmatic lymph nodes. So axillary lymph nodes, the lymph that is taken to the axillary nodes goes into the clavicular lymph nodes, and from here it is taken to the subclavian lymphatic trunk. And the parasternal nodes, they are drained into the bronchomediastinal trunk. What is a sentinel lymph node? Sentinel lymph node is the first lymph node to which cancer cells are most likely to spread from a primary tumor. So we need biopsy. If we are suspecting cancer in a patient, breast cancer in a patient, we need to get biopsy of the sentinel lymph node. Nerve supply of breast is from the 4th to 6th intercostal nerves and its branches. In this picture, we can see these are the medial branches of 4th to 6th nerve, and these are the lateral branches of the 4th to 6th intercostal nerves, and these are supplying the substance of the breast. That is all for today. Thank you.